Kei ngā kōkō mukatara whare, kei ngā kōpuni e noho moho nei ki ngā tōpito o te motu tēnā koutou. Ki ngā mate korero i te wā. Haere ki te rahi e kāpuni puni mai rā i te hāmumutanga o te tangata. Ko koe tēnā i tēnei wā e te pau o te maunga titohea o rua taranaki e pā e koro huirangi. Koe i whakangungu i te reo me ona tikanga, koe i paua ko te reo Maori kia manamutu hake. No reira, tēnei tō iwi Maori, e aue nei, e tangi nei, e mihi nei, e poroporo aki nei i a koe, o tira ato tira haere. Haere koutou e oki haere atu rā. Koutou te hunga mate kia koutou, ko te ora kia tātou, ngā waihotanga iho. Tēnā koutou, tēnā tātou katoa. I tēnei wā, ka huri ake ki tō tātou manuhiri rangatira, ko whakarau i ka mai i tēnei rā. He uri o Ngāti Raukawa, he tini ngā pōtai a tēnei rangatira. He is a GP at Papakura Māori Health Clinic. His second role is a clinical director of the National Hauora Coalition. And finally, he has joined up with other Māori health experts from across the motu, establishing Te Rōpū Whakakaupapa Uruta, which aims to ensure accurate and reliable information to whānau and health providers and iwi and hapu around COVID-19. Nō reire te matua Dr Rāwiri Jansen, whakatau mai. I'd like to say how privileged we are to have you here today, to kōrero to us. We understand you're at the front line and he nui ngā mahi kei a koe I tēnei wā, kei mua I tō aruaro.
Kia ora Kaz, kia ora tātou me taku tautoko anō ki tērā o ngā mihi ko mihia ki tērā rangatira huirangi, ko ia tērā taranaki maunga, ka tika kia hurina whakaro ki aia me tōna whānau I tēnei wā. Nō reira, ka tautoko hau tērā o ngā mihi. Ka tira, ka mihi kia koutou whakatū nei tēnei kaupapa o Paerangi. Ka mihi, tēnā koutou.
Tēnā koe, nā kōrero te matua. We'll start ko te pātai tuatahi matua. Why was it important that we have a national Māori pandemic group for COVID-19?
Yeah, kia ora Kaz. That really happened, it's just 3 weeks ago, and there was a group of Māori doctors and public health physicians and researchers, and we shared some emails with each other, and all of us had really discovered the same thing. We'd offered advice and we'd offered to help work with the ministry in terms of having a COVID-19 pandemic response that was really tailored to the needs of Māori. And all of us had received no reply, which was troubling for us. And so one of my colleagues said, it's time to put our tino rangatiratanga pants on and get busy and do this job. So we've been meeting essentially every day since then, looking at a range of issues. And we sort of got three main areas that we look at. And one is trying to make sure that there's accurate, reliable information for whānau about COVID-19. And 3 weeks ago, we were just finding out what the levels were, and we were moving from one level to another level and then going level 3 to 4, and really wanting to make sure that whānau were getting good information about what that would mean. We also recognised that iwi and hapu and Māori providers needed access to good information. So we got busy in doing some of that, and you can jump on the website www.uruta.māori.nz and you can see the sorts of things that are emerging. And then the really important last part was to direct a whole lot of activity towards the government, to government agencies, Ministry of Health, and really influence what they were doing, and try and get equity at the centre of what's happening in terms of pandemic planning. And Professor Paerangi Reid is one of the co-leaders, and Associate Professor Sue Kringle. And Paerangi was really clear in saying that pandemic response, one size fits all, is only going to lead to more inequities. So we needed to be part of having a tailored pandemic response for Māori. And in saying that, I think your audience will recognise that actually that needs to be tailored for whole lots of different populations within Māori. And we're sitting in Auckland and aiming to meet the needs of people in Auckland, but we've also got interest and services and whānau in rural areas and their needs from Kaitaia to the Bluff. And so there's lots and lots to do, but that's really why we got set up, and we're underway.
Kia ora. Ngā kōrero. So is it important to get the flu vaccination, or is the coronavirus same as the flu?
I'm going to give you the short answer and the long answer. Yes, it's important to get the flu vaccination. The reason why, there's a few good reasons for doing it, and one is that getting the flu vaccination is going to protect you from getting the flu. And if you think about that, you don't want to get the flu and have coronavirus at the same time. That's a 2-for-1 deal that you don't want.
So they're not the same?
Well, coronavirus is a flu-like illness, but it's worse than the flu that we're kind of used to. It's kind of much more like the Spanish flu back in 1918. It was a flu that humans hadn't seen before, and so it's going to kick butt. It's a bad flu. And so coronavirus and the flu virus together, you could get them both. You know, there will be countries where both those things are traveling at the same time, and that's going to really be devastating. The other reason why you want to get the flu vaccination is so other than protecting yourself, but it's also to protect your whānau and your community. And so even if the flu doesn't really knock you over, if you get it and you spread it to your whānau, you know, potentially you're going to knock some of them over. So good reason to get the flu is to protect your whānau and your community. Yeah.
Kia ora. What does it feel like when you've got it?
So we know this mostly from overseas, and many of us will be watching online about what happens with the coronavirus. And for some people, it's just a very mild illness, just like a cold or a flu. And for some people, it's a really bad flu. And for some people, it's tragically going to end lives. And we've seen small numbers of that already in Aotearoa, but we've seen large numbers of that around the world. And so this, for some people, the coronavirus will be completely devastating as a respiratory flu-like illness. And, you know, the death rates are pretty shocking. And I guess the difficulty in all of that is that some other people, it's just a really minor illness. And so for them, we're doing all of this extra work around having lockdown, pretty impressive thing to do. You know, we've never seen it in our lifetime before. And for lots of people, all they're going to miss out on is a mild flu. But for us as a nation and as communities and as a health system, what we can see is that if this really took hold, it would overwhelm our health services, and that would cause a lot of harm to a lot of people if our hospitals couldn't be working and if our primary care clinics couldn't be working. So, yep, it's a really bad flu, and it's really worth doing all of this effort to avoid the worst effects.
If you get it and then you recover, can you get it again?
Yeah, beautiful question, challenging question. I'm not sure. I've seen some of the international conversations about that particular question, and some people think that it looks like you get it once and you won't get it again. And some people are saying actually it looks more like some of the other flu where if you get it, then you're protected for about 18 months or 2 years. We've got a lot to find out about this particular virus, coronavirus. Good question, and we don't have exact science around it yet.
That's interesting. With everyone working on the COVID, how do we get other needs met? How do we get our other needs met if everybody's working on COVID?
This, for me as a GP, this is a really important question.
Yeah.
I've got lots of patients at Papakura Marae who've got existing health conditions, and that might be diabetes, or they might have a respiratory disorder, or they might have epilepsy. They might have a wound, from an injury about 3 weeks ago, and we need to see them on a regular basis to, keep the wound clean and dressed and stuff. And so for those patients, we've done a bit of extra work to try and reach out to them, make sure they've got their regular medicines. For some of them, make sure they can still get a lab test done, and for some of them to come in so we can do flu vaccinations or childhood immunisations, or look after a wound. And that's been quite tricky for some clinics to set up, but most clinics now have figured out how to do that. So you can imagine your clinic might ring you up and say, we just want to stay in touch with you, and we've organised for your medications, and they're going to be delivered, or you can pick them up at the pharmacy, or we'd like to see you, and we've got a clinic this afternoon, and you'll be safe, and there'll be a nice patient flow to keep you away from anybody who looks like they might be unwell. You'll be coming into this part of the clinic at this time. And, so that's the sort of change that I think lots of people are going to experience with primary care. So a lot more sort of organisation ahead of your visit, and phone calls and stuff, and perhaps even parking in the car park at clinic, and somebody coming out to bring you into part of the clinic, and then we'll get busy and we'll look after that wound, or we'll listen to your chest or your breathing and check those things out, and still look after you. And one of the big worries we've had is that we think that lots of people are staying away from clinic, partly because they just want to let clinics get on and do the stuff that they need to do. But some people are pretty scared about going out of their bubble, and we want to make sure that we work with them and talk with them, and if it's right, bring them into clinic, but bring them in a safe way. So that's a really important change, I think, that we've seen in the last few weeks, and we've got to, I think, do a better job of reaching out to our patients.
What advice can you give for at-risk communities to stay safe?
So the most important things that we're doing in our communities and across Aotearoa is about hand hygiene, and kia tihei koe ki te whatiangaringa. So being really cautious about coughing and sneezing, and if you're unwell, don't go to work. And that really big one is the social distancing. And so people, we've stopped, haven't we? We're not shaking hands, and we're not kissing, we're not hugging, we're not doing hongi. All of our marae have shut down. We've closed down schools, and that's giving a lot more space between people. That's really, really important. That's clearly helping us a lot. And so staying safe is about being in our bubble and keeping the people in our bubble just with us. If we don't do a good job of that, we're at risk of seeing it pop up. You can imagine across all of the clinics that I'm working with, I can see that there's a case, and it was a young woman, say, who was working at the airport, or she was working at a hotel, and so she gets exposed to COVID, and kind of want to look after her in some isolation keep her safe. But if that didn't happen and she lived in a, sort of a crowded household, and the young people might then also be down at Auntie's place hanging out with the kids down there, you could imagine that actually this will sort of explode, and it will be not just one person with COVID, but it might be 6 or 8 or 10 in one household, and next minute it's another 2 or 3 households, and suddenly it's 30 people. So our bubbles, I think, is one of the things that keeps us safe, and we've got to keep doing that for a couple more weeks at least.
Aroha mai. Does PPE gear protect you if you go out shopping? Are you not going to get the virus if you wear the masks and the gloves and the...
All right, this is good on you for asking me the hard questions. Look, as a medically trained person, we're following the evidence internationally, and the idea that everybody should wear a mask doesn't have a lot of evidence behind it. The people who should be wearing masks are people in clinical positions, nurses and doctors, and care workers who are directly touching people in people's homes or people coming into the clinic. The change in the advice in America about people starting, sort of really saying to people, it could help a little bit. I think that is really not driven by a change in the evidence, but it's driven by the urgency, the emergency that they are facing now. It's really out of control in lots of communities. And so they're really saying this could help a little bit, and every little bit helps them. So in New Zealand, we're not in a position where we're saying everybody's got to wear masks. I think everybody's already doing it. You queue up at the supermarket 2 meters apart. That's the best safety that you can have. And if you're unwell, you shouldn't be going out. So somebody else in your bubble has to go out and queue up for an hour and a half to get the groceries. But that's the most important safety thing we've got, is social distancing. So that's the bit I'm really strongly encouraging. Let's stay safe.
So it's easy to get isolated in lockdown. How important is it to stay connected with spaces?
I think it's really important. Staying connected these days is different, than it was a month ago. And for lots of people, that's a challenge. It is. Some people haven't got the mobile phone or the smartphone or the apps. And so we've got to really be sensitive to that. So staying connected with whānau these days is about phone calls and WhatsApp, FaceTime or Facebook or Messenger, all of those things. The importance is that some people are struggling with the arrangements for the lockdown, and some people are isolated, and we can spend time catching up with whānau and with loved ones and with friends, that should help us get through this lockdown period. So I encourage people to ring up and check in with whānau and friends. Stay connected. I think that's really important. And the only other thing I'd add is, if you're struggling, it's okay to ask for help. And I think that's true if there's food insecurity. If people are running out of food, it's okay to ask for some help for a food package to be delivered. And I know that whānau water agencies and other groups are making sure that there are food packages out there. And if it's something else you need, it's still okay to ask for help. If you're feeling lonely, if you're feeling scared, if you're feeling down, it's okay to ask for help. And there's organisations and there's whānau who will reach back to you. And so, that'd be my message, that if you need help, ask.
Tēnā koe, tēnā matua. Ko te pātai mutunga that Paerangi is launching today. Do you have any suggestions for this COVID?
Well, first of all, I just want to, me tuku mihi ki o koutou. te atahua o tēnei mahi, nā koutou tēnei whakatū, ka mihi, tēnā koutou. I really support the idea that you've got, and I think I'd like to just check in and say, how is it that we can be more helpful? Because I can do a whole lot of things and kind of, guess what the needs might be, but I'm thinking that there will be some specific things that whānau haua and kāpō, or people with disabilities will have needs that I haven't thought about, and I'm really open to being challenged and asked about how we can do things. In terms of being able to get into clinic, what are the issues, what are the obstacles, how do we make our clinic do a better job of serving the needs of whānau? And so I'm really open to your service challenging how my service works. So I really love that. I'm thinking about, I'm deaf as well. I've got hearing aids, and sometimes I'm worried about, can I get the batteries for my hearing aids? So it might be some really detailed questions, but we've got to answer those for people who have needs. So Paerangi looks like a place that actually we're going to discuss what do whānau need, and we're going to try and get good answers. So I think that's a beautiful thing to be doing. Ka mihi, tēnā koutou.
Tēnā koe matua, mo tō wā ko tukuna mai ki a mātua, me o kōrero rangatira, ko uhia ki runga i a mātua, i tēnei rā. E hore ngā mihi e mutu ki a koe, e tū ana i te mura o te ahi meki, kei te mura o te ahi koe i tēnei wā, e patu nei i tēnei ngāngara. Nō reira, ka mihi ake ki a koe, me o kōrero, e mihi hoki ana ki a koe whā Steph, tō tātou kai ruta, tēnei rā, e mihi ana ki a koutou, ki a kōrua, tōkorua, ki a tātou katoa, tēnā koutou, tēnei rā, tēnā koutou.
Kia ora, kia haumaru te.
Me koe hoki matua.